What's going on, you guys? It's your boy JT, and today we're going to talk about what to expect as a Term 2 medical student. Stay tuned. All right, thanks so much for returning back to my channel. I'm very excited to share with you guys my experience as a Term 2 medical student studying at St. George's University, and I figured I'd make this video just to help you guys out, especially if you're coming fresh from Term 1 and what to expect as a Term 2 medical student at SGU. If you aren't subscribed already to my channel, please hit that like and subscribe button down below. This really helps out the algorithm, and make a comment down below. Okay, now that we got all of that out of the way, let's get right into the video. All right, so the first thing that you're going to learn as a Term 2 medical student, the first module is called ER. That stands for Endocrine and Reproductive Systems. As you know, endocrine has everything to do with all the endocrine glands in the body, including the thyroid, parathyroid, the male genitalia, and the pancreas, and what hormones they make. You also want to look out for the anterior and the posterior pituitary gland. Those things are super high yield when it comes to a Term 2 ER module. You're going to look at seminal vesicles within the testicles. You're going to look at reproductive systems within the female anatomy. So I definitely want you to go ahead and, if you can, make sure you're going to go ahead and be prepared for all the histology that is going to be thrown at you. So for example, you want to know all the stages in histology of the production of an egg within the female reproductive systems. There are so many steps into making an ovum and how it's able to be liable and then sent out through the fallopian tubes into the endometrium. So you want to get familiar with all the anatomy of the female reproductive system, including obviously the whole uterus, the endometrium, the cervix, the vagina, all that stuff, and every single type of epithelium lying within those structures, as well as the male anatomy and all its epithelium. You're going to go into certain types of disorders. You're probably going to look at different types of deficiencies. So I would definitely, if you have time, look up 21 alpha hydroxylase versus 17 alpha hydroxylase versus 11 alpha hydroxylase deficiency. Those are basically precursors into androgen production, cortisol production, and ultimately progesterone production as well. So I would go ahead and definitely take a look into those types of disorders. But for right now, what you need to know about the ER exam itself is that it is a very short exam. What I mean by that is we only had about 100 questions. We had about 100 questions that were graded, and we had about 15 experimental questions. So that means that you're going to have 115 questions, give or take, but 100 of those will be graded. I did fairly decent, but definitely take a look at Brady's reviews for this module. And something kind of crazy that came up for me is they had during the exam a picture of the prostate, and it was a cartoon picture of a prostate, and it said something about the peripheral zone versus the transitional zone versus the median zone. You have to know, like, where does prostate cancer originate from, which is the peripheral zone, and what does benign prostate hyperplasia, what zone in the prostate does that affect? So you have to know these ones. Definitely really easy points on the quiz. Overall, it was a fairly well graded exam. Overall, it wasn't too bad. Just know the pathways from the hypothalamus to the anterior pituitary gland versus the posterior pituitary gland. Know the difference in histology versus the anterior, which is going to be more acidophilic, more red, compared to the posterior pituitary gland, which is going to be more dark. So definitely know all the downstream effects of ACTH, of FSH, of LH, of oxytocin, of vasopressin, and what systems they affect. That's very, very important. So that is it with the endocrine system. Second system is the digestive and metabolism module. This is the longest module that you will have as a Term 2 medical student. It is fairly long and it's pretty rigorous. So if you come from a biochemistry major or some type of biochem background, this will be more straightforward than as someone who may have majored in, like, arts or other types of sciences. It's pretty tricky. So when you come to this type of examination, and when you go into this this module, know that it's very, very biochemistry heavy. So definitely want to learn the Krebs cycle in and out, all the pathways to glycolysis, and all the pathways to gluconeogenesis, which is basically the reverse. Know every single enzyme, intermediate, what can block certain enzymes to not allow the next product to be made and what that affects downstream. You're definitely going to want to know, again, the Krebs cycle is super high yield in this exam, and there's so much disorders associated with just metabolism. So be ready for that. The exam was really interesting. So for me, our exam was a lot more of cofactors. They use the word cofactor a lot. For example, what can you make lactate into pyruvate with lactate dehydrogenase, right? So we have to know what cofactors are involved with helping that process go along, which is NADPH, right? So NADPH, that's the cofactor. What else does this cofactor help with? So now you think about, okay, what else does NADH help with? They're probably going to ask it more of like vitamin B6. Vitamin B6 is used for this pathway. What other pathway does this vitamin B6 also help? But they're not going to use the name. They're just going to say cofactor. So what I'm trying to say is that you're going to have to know the pathway. You're going to have to know the intermediate. You're going to have to know the beginning product, the end product, the intermediate product, the enzymes involved, and all the cofactors involved. And you're going to take those cofactors and apply them to different other mechanisms that they take place in, because metabolism, NADPH isn't just used for the lactate dehydrogenase conversion. It's used for so many other things. So you have to always think about, okay, what does this cofactor also help with? What does this vitamin also help with? So you always want to be thinking about that. And that will give you like 10, maybe 15 points on the exam. So be really ready for that. They do talk about pyruvate and pyruvate kinase, but you have really awesome professors. I personally love Upaja. She's definitely an MVP. She helped me go through the digestive system pretty well. Overall, the exam was decent. It was hard. It was definitely, like I said, it's more cofactor heavy. They use the word cofactor a lot, but it varies from term to term. So for example, my buddy Trevor told me that he took his digestive system exam about 5 weeks ago, and he said it was very fair. But for me, I thought it was really, really tough. So it kind of depends on what you get, but I would definitely take a look at those cofactors for you. The exam itself is worth 135 points with 15 experimental. You are going to have a whole 72 seconds per question, but you guys probably already know this. You know, before we had to take blocks, but now we don't. So you know how to take the exam. So it's going to be, once you start, you're going to go all the way through. I personally like to take a break at the half mark. So for example, if there's 150 questions, I'm going to take a break at question number 75, for example. Okay, third module. This is going to be Neurology and Behavioral 1. So we're going to be dividing the neurology sections into 3 different exams and 3 different modules. So you're going to have MB1, MB2, and MB3. So MB1, it's basically giving you a overview of the anatomy of the brain and the neck. So you have to be really familiar with the anatomy of the head and neck, specifically the brain. So there's so many different parts of the brain. There's like obviously the temporal lobe, and the parietal lobe, and the occipital lobe, and the diencephalon, which is like right in the middle, and the cerebellum in the back, which is for motor movement. So you have to know all these different structures, and it's definitely more anatomy heavy. They don't start to introduce cranial nerves until MB2, but they do introduce a few cranial nerves. I think they introduce like the optic nerve in MB1 and possibly the ophthalmic nerve, or whatever nerve it is to smell. See, I'm already forgetting my MB. And it is very, very difficult. So before I can go into it any further, I just want to let you know, kind of fair warn you, in the past, SGU has not done such a good job at teaching this material because it's very, very difficult, for one, and two, they have learning objectives, and they're going to try to keep those learning objectives with the slides. So sometimes you'll be going through a lecture and you're like, holy smokes, like this lecture has nothing to do with the previous lecture, or you can feel like it's really disorganized. So you have to be very patient with the neurology department because honestly, I'm sure they're trying their best, but It's a very disorganized module. It was disorganized for me. It was disorganized for the people before me. It was disorganized for the people that were a term below me. So just keep that in mind. It's going to be a very, very difficult module just because of the disorganization of the module, and there's a new coordinator for that module. So that may or may not help depending on what you think. But just know, like, however disorganized it is, just keep on doing, if you have PLGs, keep doing your OPLGs, do as many practice questions as you can, because honestly, for me, the exam, it wasn't a fair exam. There's only 2 exams that I could tell you from my experience where I go out there, I'm like, do you think that was a fair exam? To my friend, and they're like, no, that wasn't, and we came to a consensus like that just wasn't a fair exam. So, and what I mean by fair exam is that you have to really pay attention in lecture. Like, I don't pay attention to lecture. I take notes and make summary sheets while they're lecturing, just because I am not a audible learner. I don't learn from people telling me. But apparently they would tell you certain things that aren't on the lecture slides, but they end up being on the exam, if that makes sense. So really pay attention in lecture for those small little things. Like, for example, Dr. Kirkby might say, oh, I think this part of the brain is responsible for like taste or something. And then that could be a question on the exam, right? And it's not on the slides at all. So I barely made it through that exam. Everyone felt destroyed after the MB1, but a lot of people did pass. A lot of people didn't pass. But regardless, MB2 and MB3 end up being a little bit better, in my opinion. Okay, now MB2. MB2 is a little bit different, so we're going to start to introduce cranial nerves now. So before introducing cranial nerves, I want you to go ahead and be familiar with every single hole or ovale or foramen inside of your skull that nerves go through. So the foramen ovale, there's so many different ovales and there's so many different foramens inside the skull that your nerves go through. You have to know those. You have to know those locations. So they can give you like a picture on the exam of like the skull being opened with like different types of holes inside of them, and tells you which the nerve that passes through this hole is responsible for what. So they won't tell you the nerve, they won't tell you what ovale or what hole it goes through, but they want you to know what it does. So you have to know all 3. So I want you to know the location of the hole, the foramen or the ovale. I want you to know which arteries, veins, and cranial nerves pass through there. And I want you to know what each cranial nerve is supposed to do for the human body in that sense. So keep those things: location, what goes through it, and what does it do. Learn your cranial nerves during Module 1. I can't stress that enough. Learn cranial nerves 1 through 12 during Module 1, and you'll have a much easier time transitioning into Module 2, because when you go into Module 2 for NB2, it's all about the cranial nerves, especially the trigeminal nerve. The trigeminal nerve is such high yield that it's like not even funny. And I want you to know that the cranial nerves don't exist by themselves. For example, they can synapse at a certain ganglion. That's another important thing. I want you to know which ganglion they're going to go ahead and synapse at. So for example, there's a certain type of ganglion from your facial nerve or your trigeminal nerve that turns into the lingual nerve. And the lingual nerve is responsible for taste, but only in the anterior 2/3 of the tongue. So you have to really know these specific locations. You have to know that each cranial nerve does not exist in isolation, except for the ophthalmic nerve or whatever nerve is responsible for smelling. Anyways, it's very important that you know that. Again, there's going to be pathologies associated with this. This is where you're going to start to be introduced to like different eye disorders. So like if you have a tumor that's compressing on your silica tunica or your optic nerve or your optic chiasm, there's different pathways for your optic chiasm to go, or your optic nerve. Your optic nerve goes from your eyeballs, they cross at the optic chiasm, and then they go through opposite sides of your brain. There's different lesions at different locations within that pathway that I described, and it's going to have a different type of vision problem associated with it. So it's something that, if you want, you can look up right now. Just look up optic chiasm pathway lesions and what they're associated with vision. So bitemporal hemiplegia, whatever it's called, which is basically when you can't see. For example, when you can't see on one side on the right side, and you can't see on the left side on the left side, you can only see like the middle. It's very interesting how the eyes work. Spinal accessory nerve, there's several nerves that come off from there. And I believe the neck is more testable. There's definitely different triangles in the neck. You want to know which types of nerves pass through there, what types of arteries pass through there. Definitely high yield to know the arteries that arises from your heart, from your overarching aorta, and goes up and turn into the internal carotid and the external carotid arteries, and what they supply in the brain. So definitely want to know that. And then you may have a psych at the end, so a lot of terminology, but definitely cranial nerve season is for MB2. Okay, now for MB3, you're going to go ahead and stay away from cranial nerves. You know, they might come back as a cumulative. Well, back to MB2, the exam for MB2 was actually a lot better than the exam for MB1 for a lot of people. A lot of people knew, okay, they're not going to ask this anymore, so they're now going to ask kind of a third order. They're no longer going to ask what cranial nerve is responsible for taste. They're not going to ask that stuff. They're going to start to ask, like, the person comes in, they can't taste, which ganglion does it synapse at? That's kind of like more third order thinking. Okay, now back to MB3. MB3 was a lot of psych, a lot of disorders, lots of different types of criteria. So it's all about criteria. Do they meet these certain criteria for them to have post-traumatic stress disorder, for example? A lot of definition type problems. It's a lot more straightforward than MB1 and MB2. And MB3, it can kind of sneak up on you because you might start being more lazy in your studying. Oh, all I need to do is just learn a whole bunch of definitions, but it's not that way. You definitely want to keep on top of the second order, maybe third order questions that they can ramp up on you. Time frames are really crucial for personality disorders. So definitely take a look at the time frames. For example, somebody could have gotten back from a tour in Iraq and they're having these symptoms. Everything's telling you that he has post-traumatic stress disorder, but guess what? He's only had these symptoms for a month, you know, or 29 days. And for somebody to have post-traumatic stress disorder, they have to have at least 6 months of these symptoms, right? So you have to know these time frames. Time frames are really crucial, as well as the major and the minor symptoms. There are such things as major symptoms, and there are such things as minor symptoms, right? So there's different type of categories. So for example, in order to, you know, diagnose somebody with post-traumatic stress disorder, you have to have at least like 2 major symptoms, 1 minor symptoms, or you have 3 minor symptoms and then 1 major symptom. So you kind of have to like know all these nuances, but definitely if you take your time, if you stay on top of it, you should be fine. So that is it for the modules of term 2. Now you have your BSCE. So what can I give you as advice for BSCE? BSCE is basically a cumulative examination that will be curved in a very special way. I don't really know how they curve it. They don't do it a traditional curve, like they don't like take the median and then like push you up that way. It's very interesting how they do it. I think they send you an email saying how exactly we curve it, but regardless, what can I say in regards to preparing for this exam? Not very much. And the reason why I say this is because it is so random. There's so many things that you've learned from term 1 all the way through term 2 that can pop out at you. But what can I say? What I can say is this: don't put BSCE priority over your material that you are learning currently in term 2. Don't ever want to do that. If you want to set aside an hour or so a week, you know, going through it, I know some friends that have done that and they did pretty well. Me personally, I did not do that. I honestly waited like the last 2 weeks and just started going through a couple of the ESOP quizzes that was given to us during term 1, and that's all I did. I also went through the Michigan's 100 must-know disorders, and that was kind of helpful. It kind of went through like, you know, MSK, a little bit of like, you know, appendicitis, very basic stuff that you should probably know. But honestly, at the end of the day, I felt like none of those helped. At the end of the day, everything was so random. Like we had like Philadelphia chromosome. I don't even know what that does. I forgot what it does. Just very random stuff. They say it's first and second order, but I believe that there's a few third order questions in there. As far as the BSCE goes, it's definitely, I would say not the most fair exam at all, but they do curve it. So for example, our class got a 20-25% curve, and I got like a raw score of like 53 or 54 or something like that. So I got a pretty good bump from that, and I was really thankful to be to be able to pass on and go on to the next term. But if you are having anxiety about this, reach out to me. I'd love to give you resources that help me a little bit. But at the same time, I wouldn't stress over something that honestly is going to get curbed at the end of the day. Don't sleep on it. Definitely you want to at least go over some practice questions. You want to go over some of the Google Drives that have like dumps, they call it, which is like basically students come out of the exam, they dump everything that they can remember from the exam, and then they put it on a Google Drive. I've seen some of those exact questions, you know, on the next exam, and they've actually helped me out a lot. So definitely take a look at all those Google Drive dumps, especially. Take a look at the ESOP quizzes, but don't stress it as much as your actual current examination. So, all right, that is it for me, guys. Thank you so much for being so patient with me. Term 4 has been crazy. I am currently in Trinidad and Tobago in a little apartment that was really cheap, and I have a 24-hour layover, so I'm gonna spend the night here, hopefully make it to Miami tomorrow, and I'll be in San Francisco, then in Oregon, finally back with my family, and I'm very excited to see them for the holidays. Thank you guys again so much for supporting my channel. I really appreciate you guys. If you have any questions, and go ahead and send me a message through Instagram. Now, before I let you go, if you want to go ahead and get a hold of me through Instagram, make sure that you are following me. If you're not following me, it's really difficult for me to find your message because it goes to a request, and I don't really check those that often. So definitely, if you feel free to contact me through Instagram, that's the easiest way, but make sure you follow me so I can go ahead and make sure that your message gets moved up to primary or at least general, right? So again, I'm here for you guys. I want you guys to succeed. I wish I had the videos to help me go through term 2. Term 2 is hard. Term 2 is very hard. Few people had to repeat, but you can do it. You can do it as long as you put in the work. You find time for yourself to relax. Don't just study every single day. You know, I would take Sundays off completely and not study at all, and I did perfectly fine. So take time for yourself. Thank you so much again for watching this video, and I'll see you in the next one. Peace out.